Do you know that a fertilized egg needs to be implanted in the uterus for the development of the embryo? And do you also know that sometimes there can be complications or there can be health complications which will lead it to mislocate or be implanted outside the uterus or mostly in the fallopian tube? We will be looking at ectopic pregnancy today, the causes, its complications, and how we can prevent ourselves from having ectopic pregnancy. This is Health Talk with Fiifi. My name is Ajwa Duma Ansa. Now, let's get into ectopic pregnancy. What at all is ectopic pregnancy? So, as a diagram on your screen showing, a fertilized egg needs to be implanted in the uterus. So, as you can see on your screen, that is the uterus and a fertilized egg being implanted in the uterus. Now, ectopic pregnancy occurs when a fertilized egg implants or grows outside the uterus, but mostly commonly in fallopian tubes. So instead of growing in or being implanted in the uterus, it stays in the fallopian tube to grow, or sometimes outside the uterus to grow. So this can happen due to many abnormalities in the fallopian tubes. It could be scarring from previous surgeries or infections, hormonal balances, or certain contraceptives that one is on, or certain birth control methods that one is on, can put one at risk of having ectopic pregnancy. I repeat, in ectopic pregnancy, it happens due to abnormalities in the fallopian tube. It could be scarring or a scar from previous surgery or previous surgeries in the fallopian tube, or infections in the fallopian tube, or hormonal imbalances, or certain contraceptive methods or birth control methods that one is on, can put one at risk of having ectopic pregnancy. Now, let's look at symptoms and how ectopic pregnancy can be diagnosed. So how can I be diagnosed of ectopic pregnancy? So I know I test positive for pregnancy and I go to the hospital. How would the doctor know that I have ectopic pregnancy? So you can see on your screen abdominal pain and discomfort. So this lady on your screen is experiencing abdominal pain and discomfort. So you can see where she's holding the abdomen, and you can see from the picture experiencing a discomfort, a pain in the abdomen. So symptoms include abdominal pain, vaginal bleeding, shoulder pain, dizziness, and mostly the diagnosis is confirmed through ultrasound. So we have ultrasound image to confirm that the fetus is being implanted outside the uterus, or the fetus is implanted in the fallopian tube. Then we say you have ectopic pregnancy. Blood can be taken to the laboratory to measure hormonal levels, to also add to the ultrasound to confirm ectopic pregnancy for proper medical attention. Also, risks. What are some of the risks and complications of ectopic pregnancy? So ectopic pregnancy can pose serious risks, which includes rupture of the fallopian tube, internal bleeding, and infertility. So one ectopic pregnancy could lead one to have rupture of the fallopian tube, bleeding internally, and infertility, because that is not where the fetus is supposed to be. That is not where the fetus is supposed to be. So it could lead to a rupture of the fallopian tube, internal bleeding, and infertility. So rupture of the fallopian tube can lead to life-threatening internal bleeding. And there is prompt diagnosis and treatment, which is very crucial to prevent the complications. So most of the time, surgery is being done to take out the implanted fetus or to take out the ruptured fallopian tube. Let's get into treatment and options. So treatment for ectopic pregnancy depend on the factors such as the woman's health, the location and the size of the ectopic pregnancy, and the presence of complications. So before we can say we are treating or we are giving you treatment or managing your ectopic pregnancy, it has to be on these factors I mentioned: your health, the woman's health, the location of the pregnancy or the location of the implantation of the fetus. Also, if there is presence of complications. From there, the doctor will know the treatment options to go. So treatment options include medication to stop the growth of the pregnancy. So you can't be giving medication to stop the growth of the fetus or the pregnancy. There can also be laparoscopic surgery to remove the fetus or to remove the implanted fetus. So we are removing the ectopic pregnancy. So there are laparoscopic surgeries to remove the ectopic pregnancy. Or in severe cases, there is surgical removal of the affected fallopian tube. That is, if the fetus or the implantation was done or occurred in the fallopian tube, that affected fallopian tube in severe cases are surgically removed. So after treatment, it is very important for women to rest and to follow their doctors' recommendations or advice. So women who have ectopic pregnancy may need emotional support, because aside ectopic pregnancy, even having a miscarriage, a normal pregnancy, and losing it as serious, or it's sad. So you having ectopic pregnancy with the all emotional trauma, one needs emotional support. One needs emotional support and counseling. Also, women who has ever had ectopic pregnancy and their pregnancies are being surgically removed or has to remove their fallopian tube, they need to follow up for essential monitoring for any complications, and to assess any future fertility. So these are some of the recovery follow-ups a woman with ectopic or a woman who has had ectopic pregnancy can follow or can do for proper medical attention. Thank you so much for staying with us on today's episode on ectopic pregnancy. And I know today you've learned that there is ectopic pregnancy, which is whereby the fetus or the implantation is being occurred in the fallopian tube or outside the uterus. And this can pose serious medical condition to the woman and needs to be surgically remove the pregnancy or the affected fallopian tube. This has been Health Talk with Fiifi, with me, Ajwa Duma Ansa. Thank you for staying with us. Kindly follow us on all social media platforms. If you are not following us, at Health Talk with Fiifi, and subscribe to our channel at Health Talk with Fiifi, and let's get interactive. Have a good day. Bye.